As part of my health and survival plan for you, I'm answering all medical questions and letters that's being sent in. I recently received a letter from Luke. Luke writes in, "Dear Dr. Sampson, I have had severe chest pains. Felt like I was having a heart attack. Didn't know what to do because I am 40 years old. Never had this happen before. Maybe it was an anxiety attack. I went to the emergency department. They couldn't find anything wrong with me. $7,000 later, and I'm regretting it. I'm regretting the fact that I went there because I have no health insurance. Should have gone to the ER." Luke, absolutely you should have gone to the ER. I mean, I get it, chest pain is nothing to be toyed around with. And what happens is in the emergency department, we do a battery of tests, especially if you're at age, if you have risk factors. Some risk factors includes high blood pressure, diabetes, smoking, family history, and high cholesterol. Your 5 main risk factors for heart disease. But chest pain is for real, and you can't take chances on chest pain. So by going to the ER, you absolutely did the right thing. And I get it. You don't want to waste your time. The cost of the bill is expensive. The hospital cost is out of my control, but it's a very expensive bill. This is why health insurance is important. You want to make sure you have health insurance, either through your job. Today, there's the Affordable Care Act, what we call AKA, also known as Obamacare. So you want to make sure you have some form of health insurance to defray the expensive cost of health care. And that's why it's called insurance, just in case you need it. So you did the right thing by going to the hospital, because here's the thing, and this is the truth, Luke. Had it been a heart attack, you could die. You could die. Or you may have been saved, but have compromise with your heart, congestive heart failure, difficulty breathing, difficulty performing for the rest of your natural life. But you don't want that to be you. There's many of you guys out there listening today that's similar to Luke, that has the same symptoms, and you must go to the emergency department or go see a doctor when you have these symptoms, especially if you have risk factors. As mentioned, high blood pressure, heart disease. Well, high blood pressure leads to heart disease, or high blood pressure, diabetes if you smoke, high cholesterol, and a family history. These are all 5 major risk factors for heart disease. So Luke, you did the right thing. For all of you out there, make sure you do the right thing. If you have chest pain, go to the emergency department. Allow me, my staff, other emergency medicine physicians, and healthcare professionals to take care of you. It's important. We want you around. Don't be a tough guy. Don't be a tough guy. Not in this case. Not when your heart is the main engine that propels blood throughout your body. Luke absolutely did the right thing. Make sure you follow up with your doctor as well. And for all those out there, make sure if this is you, if you're similar to Luke, you go to the hospital.